Sorry.
Senator, wouldn't Mayo be a good ally in this endeavor? I mean, my understanding is that they're not like Alina, they're not, you know.
Oh, yeah, they are. We're in Mayo monopoly.
Unfortunately, they have some of the best care in the world, and I'm going to say Alina Hospital has some very good care too. Some of the best doctors in the world in there, some of the best clinics, some of the best stuff there. If you want to know how they treat people, ask people at Fairmont, Minnesota, where they shut their hospital, or Albert Lee, where they cut their hospital by about 2/3. Why did they do that? It was not to improve care. It was because it was better for their bottom line. Ask how they treat their cafeteria workers, ask everything else. It's a very corporate system with investors, everybody else. The core institution is not for profit. I would say that they're finding ways in which the people who are running these nonprofits and so on are making more and more money. So they have some, in other words, it's not like, oh, they're a villain and they're a villain. I don't spend my time trying to vilify people, but say that I wish they would be a strong ally. I have a feeling with the provider tax that we have, I'm not a big fan of the provider tax, but I'm carrying a bill to put it back in place because we need the money to do this. I'd like to abolish the provider tax, and with the logical system we would, but for now we can't. And the provider tax, the AMA came up with an alternative, and it's a huge gift to Mayo. Is that only people in Minnesota have to pay, which means half or more of Mayo's patients don't have to pay the tax. So it's a big gift to them in effect compared to other hospitals. But so I don't want to vilify Mayo because it's got wonderful stuff going on. Their heritage is great.
Yeah.
Every one of these nonprofits started out great, and they morphed.